Okay, we'll start now because I think time's moving on and we've got quite a good audience. So hi everyone, welcome to this really exciting webinar on the relationship between the built environment, climate change and mental health. Before we begin, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the land which I'm currently on, and pay my respects to elders both past, present and emerging. It always was and always will be Aboriginal land. So just to introduce myself, I'm Marley Bauer. I'm a research fellow at the Matilda Centre for Research in Mental Health and Substance Use at the University of Sydney. Today, I would like to welcome you to what will be a really exciting webinar and the fourth in a series in a collaboration between the Matilda Centre and the Henry Halloran Trust here at the University of Sydney. So I'm just going to, before we start, give you a bit of more of an insight on what we do as a network. Ooh, sorry, my mouse has got stuck across my multiple three screens. Okay, here we go. Oh, there we go. So yeah, basically, the network began through a workshop between academics and practitioners in psychology, mental health, physical health, urban planning and architecture, where in our own experiences of work, we'd noticed that the relationship between the built environment and mental health was there, but there wasn't so much of a common language to link these areas, or a kind of a close interdisciplinary language. So for example, in my own research, I've looked at the experience of loneliness amongst people who are homeless or socially disadvantaged. And what became clear was that the inequity in the type and quality of spaces that people are often allotted or in these groups in our society are often of poor quality, and the personal needs and desires of these groups are often not taken into account. So we formed a network to look at these issues in an interdisciplinary and collaborative way. And the aim of the network is to bring together researchers, policymakers, and practitioners currently working independently across silos to share skills, expertise, and develop frameworks, and to promote the role of mental health in built environment research and practice settings, and of the built environment in mental health research and practice settings, and more generally just to build capacity and translate research evidence into public health and planning policy and practice through inbuilt partnerships with practitioners in the field. So if as a practitioner, a researcher, or a policymaker, you're interested in either joining the network or being on a list to hear about any further events or publications, please register via the link that you'll be sent tomorrow in an email, and feel free to share any comments about things that you'd like to see in the future, as we'd love to hear from you. And we have been a little bit slow lately with all the different ways of COVID and things like that, but are hoping to ramp things up in the near future. So now to start discussing what we're all actually here for. So we know that where we live, including our housing and our neighbourhood, directly impacts the extent to which we feel the negative impacts of climate change, such as heat waves or the very recent floods. And emerging evidence suggests that this may also create inequalities in the impacts of climate change on our mental health and well-being. The terrible flooding in these past few weeks has been a real and distressing example of the destruction and damage that climate change can cause or have on our housing, our communities, our health and mental health, and really highlights the importance of research in all these areas and the importance of planning for the future. So the plan for today is to listen to our expert speakers present for about 10 to 15 minutes each, before we have a very short Q&A at the end of the presentations, led by my colleague, Liv Green. So please use the Q&A chat function on Zoom to post your questions, and it will help us if you can keep questions direct and simple to the point. If you do have comments or broader areas for discussion, feel free to email the presenters for discussion off air. But now on to our expert presenters. So first up, we have Susie Burke to talk about climate change and mental health. So I'm going to stop sharing my screen so we can focus on Susie. Here we go. Oh, no, go back. Obviously, I'm not so good at tech stuff. All right, let's have a look. Back to Zoom. Ooh.
I'm happy to start talking, Marley, while you're fiddling with your tech in the background.
Let me at least read your amazing bio so people kind of get a sense of who you are. So Dr. Susie Burke is an environmental psychologist, therapist, climate activist, and parent living in Central Victoria. Her key interest is the role that psychology plays in helping us understand the causes, impacts, and solutions to climate change. For 17 years as senior psychologist at the Australian Psychological Society, she developed resources on coping with climate change, raising children for a climate-altered world, and disaster preparedness and recovery. She now works in private practice, consulting to organisations and running workshops and individual sessions to help people come to terms with climate change. She's also an adjunct associate professor at the University of Queensland. So over to you, Susie.
Thank you very much. Well, hello and welcome, everybody. So I'm coming to you today from Jaja Warang country, where I live in Castlemaine in Central Victoria. And I also just wanted to acknowledge right at the very beginning that we're meeting in the time of climate crisis, and that everything that we're currently working on in our personal and professional lives is going to escalate in difficulty in the years to come if we don't take urgent action to do something about climate change. And this is an acknowledgement that we, when I was working at the APS, at the Australian Psychological Society, together with colleagues, we tried to institute as a thing to do at the beginning of meetings, to follow after an acknowledgement of country, was to also acknowledge the reality of what we're doing, regardless of whether we were meeting to talk about homelessness or meeting to talk about, other issues as well, just to sort of put it front and center in our reality. And we know what we need to do about climate change to restore a safe climate. We just need to get on and do it. So that's my prequel. So what I'm going to talk to you about today is, I'm sort of going to cover three things. Briefly, I'm going to talk about the causes of climate change and the impacts it has on mental health. And then I'm going to talk about the different sort of mental health impacts. And then I'm also going to talk about what we can do with that, how we can cope, and look at these three specific coping strategies that come up in the literature and in our useful lives. So the first thing is, when we're talking about the way in which climate change impacts, we look at these three different causes. We look at the direct causes. So these are things like the extreme weather events that we've seen all down the coast just recently with the terrible flooding. And then we look at indirect or the gradual causes. So this might be the flow-on effects of a direct effect like the flood. So, it destroys infrastructure, it destroys homes and properties, and there are these flow-on effects that cause these economic disruptions and these social disruptions and these increased stresses in people's lives. So that's one example of the indirect pathway towards having an impact on people's well-being. But there are also in that category also the gradual causes of climate change. So these might be the slower moving changes. So this might be things like overall shift in growing seasons. So as the temperatures change and the growing seasons change, that has a huge impact on farms and farming viability, and that also has impacts on people. So there's direct, and then there's the indirect / gradual, and then the third category of causes of distress for humans is the vicarious impacts of climate change, the ways in which climate change might not directly affect us, but knowing about climate change and how it's affecting other people in other parts of the world, or how it's going to affect other people in the future, can have a huge impact on ourselves as well. So that's my first point. And the second thing then, when I'm talking about the effects of climate change on mental health, is to look at what are we talking about when we talk about mental health. So there's the pointy end, which is sort of the mental health, psychological, diagnosable disorders. So things like depression and PTSD and complicated grief, which are the three most common mental health problems that would come after people have been impacted, for example, by an extreme weather event, disaster, even though it's worth noting that for the majority of people, normal recovery is what we normally expect, but there is a significant proportion, about 15 to 20% of an affected population that are at risk of going on to develop those pointy-end mental health problems. And then there's a category that we call a psychosocial well-being. So this is things like increased stress and worry and distress and grief and anger and guilt and strains on relationship and increased uses of substance and a sense of loss and frustration, helplessness and hopelessness. And we can nod at them because even if we weren't affected by the floods, we know what that feels like. And those are what we call the psychosocial well-being effects. And then there's another category where we talk about the community health effects. And this is not quite so well researched, but that this has huge connections to our built environment, our neighborhoods and the communities that we live in. So what we also find is that that climate change can cause decreased community cohesion. So if, for example, a community has been badly affected by flood or fire or something, and people have moved and half the people have gone, half the people have stayed, but the footy club doesn't work anymore because it's disrupted, you get these disrupted community cohesion and disruptions to your sense of belonging and continuity in communities, which are really important parts of our well-being. And what we also know is that climate change can cause increased domestic violence, increased interpersonal aggression, increased levels of violence and crime, and increased social instability. So we call these all community health as well. So that's my second point, is you've got the mental health, the pointy end of diagnosable disorders that people are more at risk of. You've got the psychosocial well-being effects, that's the stress and anxiety and distress and grief and loss and all of those sorts of feelings. And then we've got the community health impacts as well. So then my third thing that I was going to talk about was, and my way in for this will be to talk perhaps about the vicarious impacts of climate change, because for most people in Australia, this is how we experience climate change, not through the direct effect of an extreme weather event that has got the finger marks of climate change all over it, but through sort of more of the gradual impacts, the increased temperatures, but the increased levels of stress and worry. And so to talk a little bit more about that, surveys show that large numbers of people, and a recent survey that was done on young people last year showed that 60% of young people were very distressed or distressed about the effects of climate change, and adults show, similar numbers. And these feelings that we have about climate change are rational and they're appropriate and they're deserved, because this is what in 2018 was called for the first time there's this annual global, what's it called? An annual global risks report that is done every year, and hundreds of risk analysts all over the world look at all of the different risks that are affecting the world, and they rank them in terms of most likelihood and most severity. And in 2018, climate change topped the scale on both. So it was the most likely risk that was going to affect, and it was going to have the most calamitous consequences. And that was when they called it a truly existential threat to the world, meaning it threatens our very existence. So you can see how it's absolutely right for us to feel freaked out, frightened, a sense of dread, worry, guilt, all of those, really difficult feelings. And so I often am running workshops for people, and working with this in my individual work as well, because I work both as a private practitioner, but also sort of consulting to organisations and things like that. I often talk about what are the ways in which we can cope with climate change. And coping involves a range of different activities. And I love this model that an environmental psychologist called Maria Ojala, who's a Swedish psychologist, has started to use several years ago when she was researching how young people were coping and coming to terms with climate change. And she went right back to this very familiar stress and coping model called the transactional model of stress and coping, which I remember using in my PhD years and years and years ago. And it's got these three types of coping, and it's a very nice summary of what are the best ways in which we can sort of come to terms with and cope with a problem like climate change. So the three are emotion-focused coping, problem-focused coping, and meaning-focused coping strategies. So I'm just going to briefly talk about each of them. So emotion-focused coping is the things that you do to manage the emotions, the very uncomfortable feelings that you have about something that is a threat. So these are the things like the classics are move your body, do exercise, go for a walk, move your body to move the feelings, to move stress hormones in your system. Another one would be stress reducing conversations, talking to somebody that you trust and sharing how you're feeling about it and having them sort of listen in an empathic and sympathetic way. Another one would be taking a break, looking after yourself, spending time in nature, spending time in the very nature that you might be feeling so distressed is under threat, spending time not worrying about the problem, all those sorts of things, the ways in which we can deal with painful feelings. So the second one then is the problem-focused coping strategy. So these are the things that we do to tackle the problem that is causing the distress. So this is the things that we do to reduce the threat of climate change. This is anything that we do that is to mitigate, i.e. reduce the emissions that are going into the atmosphere or sequester carbon. And it's all of the things that we do to adapt to the threat as well. So mitigation and adaptation actions. And so actions are the things that we do with our legs and our arms and our words, our mouths. That's sort of, those are the ways in which we act in the world. So anything that you're doing, so I mean, your legs, you can, if you were walking to the train station instead of hopping in the car and parking at the train station, all those sorts of ways in which we move ourselves around. But when I'm talking with people about the different sorts of problem-focused coping strategies, I always make the point too that it's important to think about the size of your impact as well. And because we can't all day, every day, be thinking about all the things that we could do to reduce the threat of climate change, it helps that if we are doing something that we're getting biggest bang for our buck. So to look at all the things that you could do and think, okay, well, with my limited time today, whilst I'm running around doing all these other things, what's the most impactful? What's got the greatest emission reduction potential is one way of looking at it. Would that be to ring my superannuation fund and go, what? How come you're still, funding fossil fuel things? Or it might be to ring a politician and say, what? Or, whatever. So it's really useful to think about, what can I do that has got the greatest emission reduction potential? And it's not always the thing that you think it might be, which might be the, not taking the car to the shops and riding your bike instead. Sometimes it's actually about joining group actions and putting, a group amount of pressure on a politician or on your leaders or things like that. So, so that's problem-focused coping strategies. And so that's where your action comes in, taking action on the very things. And then the third category, and this is the last thing I'm going to talk about, is the meaning-focused coping strategy. So these are the things that you do with your thoughts, your thinking, to change the meaning that you make of the problem. Or to change the way you think about the problem. And so there's a variety of different things that we can do here with meaning-focused coping. So one of them would be to look and notice all of the millions of people around the world who, just like you and I, care deeply about climate change. And I'm very pleased that just before I joined this seminar, I saw that the ACF had put out a poll today showing their fantastic results of how many people care deeply about climate change and want government to do more and blah, blah, blah. Just good timing to send off to your local politician, which I did while I was waiting for everyone to join the call. So I did a little bit of problem-focused coping in the meantime. So yeah, noticing all the millions of people around the world that are actually doing something about it is a really important strategy, because it helps us to realize that now is not the time for despair. It's not time to give up yet. Actually, a lot of people care about this, and there's an enormous amount of energy that we can put to solving the problem. So that's one. Another one is thinking about how wicked problems in the past have been solved, and to notice that they have been solved. So I'm thinking of things like, women getting the vote, and the end of apartheid, and the end of slavery, and all these sorts of things. And the general trend worldwide is always in the direction of improvements in health and well-being, and reduction in infant deaths, and increases in numbers of girls having education. And it's really important to notice that, and to also learn from those past examples. So that's another point. A third one is also, so we're talking about meaning-focused coping strategies. Oh yes, it's to think about all of the ways in which a zero carbon economy, so, you know, a world in which we've transitioned away from our dependency on fossil fuels could actually be better for us. So to be thinking about the positives of a zero carbon economy. So, you know, more active transport and eating lower on the food chain, more fruits and vegetables and healthier bodies and healthier air, because we're not burning coal so much, we're, you know, producing electricity through other means and things like that. But another part of that one is also to not just be thinking about the positives, but also to be developing visions of based on maybe things that haven't been thought of yet, or plus all of the many, many solutions that have already been created that are absolutely viable, and creating visions of what the future could look like and telling stories about it. Because when we can picture where it is that we need to go and we can put it into words and tell a story, what it does is it brings up in us the determination to take the next steps to get there. And so that's another example of meaning-focused coping, where we're using our thinking and the way we think about the problem to stay engaged with the problem and not just tuck ourselves into bed and pull the doona over our head because it's all too hard. So, and that's what, you know, good coping is. I mean, you could also have a break and go to bed, but you don't want to stay there. Okay, well, that's all that I was going to share. So over to the next person. Oh, unless there's questions, or we do questions at the end.
Questions at the end, I think.
Okay.
But thank you so much, Susie. That was awesome. And I loved it how it came to a really practical end as well, of the tips of what we can actually do on a daily basis to make change. So now I'm going to introduce Professor Susan Thompson to talk about healthy built environments. And want to acknowledge, first of all, that Susan is actually joining us from her leave to be here. So that's a very special kind of privilege for us. So Dr. Susan Thompson is Professor of Planning and Associate Director, Healthy Built Environments at the City Futures Research Centre and the School of the Built Environment Faculty of Arts, Design and Architecture at UNSW. Susan is one of the first urban planners in Australia to advocate for the importance of healthy built environments, making significant contributions to the field's research evidence-based, interdisciplinary education curriculum and body of scholarship from an innate urban planning perspective. Her contributions have advanced understandings of the supportive nature of the built environment for health and well-being as part of everyday living, contributing to legislative innovation, policy and practice to enhance strategic relationship between urban planning and health. Susan has received numerous awards for her work, including the prestigious Sydney Luca Medal and the Australian Urban Research Medal. Susan is an avid Nordic pole walker and sun hat wearer in vast green urban spaces and delights in unexpected connections with people and their furry companions on her mentally and physically restorative rambles, which I think is problem-solving coping if we've ever heard it. So over to you, Susan.
All right. Well, thank you very much, Marley, and it's a great pleasure to be here. And I would like to start by acknowledging that I'm actually on the border of Wongal and Gadigal land of the Eora Nation in the inner west of Sydney. And I want to just say that the First Nations people lived in harmony with their environment for thousands of years. And the beauty of the places we enjoy today is all to do with their stewardship of place and nature. A tiny bit more background, and I appreciate what Marley's already said, but I think it's just important to emphasise that I am first and foremost an urban planner and have been all my career. It originated in many years indeed in practice, and even many, many more years now in academia, but I came out of practice in local government. My passion and driving force as an academic has always been and continues to be me being at the interface of practice. And for nearly 2 decades now, I've been working in the field of what I call healthy built environments. So my field of urban planning originated out of concerns for human health. And here's a couple of images around some of those earlier concerns. And it's interesting that planners came up with some pretty impressive initiatives around how to make the built environment much more supportive of people's health. This is a mural. It's in the Haberfield suburb in Sydney's inner west, and it celebrates the garden suburb. And the garden suburb was a massive movement in planning that was all about removing people from the dirty, polluted inner cities to live in green and healthy living environments. And sure, there's a lot of issues around that, which time doesn't allow me to get into, but it's just important, I think, to acknowledge that planners have had enormous contribution way, way back in terms of creating healthy built environments. And whilst this is a somewhat busy slide, it also is an acknowledgement of planners today and their increasing appreciation of the importance of the built environment in supporting health and well-being. Called the settlement map, it shows very clearly that health is well beyond us as individuals. Our health and well-being is very much dependent on how we live and where we live. Indeed, issues to do with equity as well. And it's also right out to the edges of the global ecosystem. It's the health of our planet, which of course ultimately underpins all life. So let me briefly explore how the built environment supports health and well-being. And yes, I do know we are talking about climate change, so we'll get to that. Healthy places support and encourage physical activity as part of everyday living. And that everyday living is something that is critical. And it's for everyone, right across the life course, for all ages. And of course, and Susie said it brilliantly in some of her wonderful coping strategies, we all know that being physically active is positive for good mental health. Being active in everyday recreational activities can reduce stress, depression, and anxiety. And did you know that GPs now write park prescriptions to get their patients with mental health issues active in beautiful natural environments? Of course, they write those prescriptions for others in relation to other conditions, not necessarily only mental health conditions. So maybe next time you're visiting your GP, you could ask for a park prescription. It's also about how we get active for transport, and health supportive places make commuting to work, to school, to uni, and to everything else we want to get to in our daily lives easy and fun. That's an important word too. Fun every day and easy to do, so that we're getting lots of physical activity in our daily life. Public transport is also an important way of getting people active as part of their daily commute and getting around more broadly. So it's about cycling, scooting, walking to the train, to the bus, to the tram, and then, of course, to your eventual destination. So moving now to think about how healthy places also support us getting access to healthy, fresh, nutritious and culturally appropriate food, and especially plant-based food, which is positive for the planet's health too. And Susie also mentioned that in her presentation. Just a few examples of getting access to healthy foods. Community gardens, one of my favourite examples here. They have multiple health benefits, and it starts with access to fresh food, but it extends to physical activity, to social connection and contact with nature, all of which are really important for mental health. And another favourite of mine, similar to the community garden but based in schools, is the school kitchen garden. They build life skills around growing and cooking healthy foods, and hopefully engendering a love of doing all of that and making that a highlight of everyday living. And even out onto the streets, and indeed some of you may well be involved in some, if not in all of these activities, creating edible nature strips giving access to healthy food, as well as creating community connection in a local street and making the street feel much more like it's everyone's, it's part of the community, and it's a safer place then. And safety is really important in connecting communities and making a healthy city. So indeed, connecting communities is a big part of a health supportive neighbourhood. This is how we feel a sense of belonging and relationship with others. And we've got to make sure that we establish this sense of connection right from the get-go, so that when these disruptions come along, we've got that connected base on which we have a foundation to cope with the disruptions. This is a favourite of mine, the dog park, which is a great site of community connection. And I know the Matilda Centre had a wonderful session on companion animals and dogs. So if you're interested, you could explore more about that. But dogs are fantastic in that they break down social hesitancy and they connect people as well as dogs. And they involve us being active and happy. There's a lot of fun in that dog park as well. And green spaces, good quality green spaces that are well located and sufficient in terms of the numbers and the amount of green space, supports our physical and our mental health. But climate change is disrupting the provision of a health supportive environment, most recently reinforced by the 6th IPCC report, and a pertinent quote, which I've just got on this slide, the second quote from one of the Australian authors, and I'm going to read that. If we are going to protect our population from the impacts of climate change, a healthy population to start with is vital. So prevention is fundamental. And I think that's really, really critical. So we've seen these images very, very sadly, most recently. This is an image from 7 television on the massive floods, and an image some time back from SBS TV on ravaging fires which regularly go through the Australian landscape. But I think it's really important to consider the so-called smaller disruptions to our local environments in terms of climate change impacts. So here's an example. So this is a localised flooding event, indeed, along that area where I march along with my Nordic poles. But these sorts of smaller disruptions impact on everyone's abilities to undertake health supportive behaviours in their local neighbourhoods as part of everyday life. This was a very recent image about showing the increased moisture, which can make walking paths and recreational areas slippery and increase the risk of falls. This could be both perceived risk and actual risk, and these will both affect those who are not confident walkers. And this is particularly our elderly folk and those with disabilities, groups which indeed may be highly dependent on the mental health benefits of social connection when they are out and about. And it's also important to note that such moisture provides extra breeding opportunities for mosquitoes and the risk of diseases carried by these insects. Smoke from bushfires. This is also an image I took back in at the start of 2020. This massively inhibited people, especially those with pre-existing lung conditions, from exercising and socially connecting in outdoor settings. And large trees falling as a result of high winds and sodden grounds, clearly dangerous for everyone, but especially for walkers and cyclists out and about. And this is an image that greeted me just the other day, the area where I walk regularly. Drought and heat mean a lack of rain and water for our local gardens, as well as reduced amenity in parks and on recreational paths. So what can be done to enhance health supportive places that are increasingly impacted by climate change? And I just want to share a few ideas, particularly to spark discussion in the session a little later. Well, first up, and this is a very, very focused passion of mine, is that we can provide quality shade, and this is both built shade and natural shade. The built shade clearly evident in this particular image. Shade has important co-benefits of reducing harmful UV exposure, reducing our risk of skin cancer, which is such a big issue in Australia. And at the same time, shade provides cooling to make it more pleasant to be physically active outdoors. And it's so important that we ensure that people can be active outdoors for all of those health benefits that brings. Good design is also critical here, because good design underpins great health supportive places. This image is of a beautiful water play park in Cairns in Northern Australia, where it's incredibly hot pretty much all year round. But designs such as this invite participation in healthy behaviours and speak to the climate, the context in which activity needs to continue and people need to participate. Perhaps this is, maybe for some talking about the obvious, but it's not necessarily the case. So providing a place to be outdoors and take a rest, making sure our public spaces enable everyone in the community to enhance their health and well-being in outdoor settings. So attention to detail is critical, and it's not just about high-end design. It's about thinking about, are there sufficient seats for people to sit down, and are they of such a design that makes it comfortable for them to sit down? And then there's multiple other supportive infrastructure. Again, all about the detail, not necessarily high-end design, but things that enhance and support people getting active, connecting with others in outdoor areas, which is just so fundamental to their health, their mental health and well-being. And I'll just point out one of these, and that's toilets, something that just cannot be overlooked and not understated. My final 2 points. In the increasing importance of public green open space for both human and planetary health, just reminding you of the important co-benefits for health that providing green open spaces everywhere brings. So in concluding, I'd just like to make 3 points. The built environment is critical for supporting our physical and our mental health, and clearly these two are closely interrelated. Climate change threatens every aspect of our local built environment. These are the places that we interact with every day across the life course, and they are critical to our health and ensuring that we engage in good quality preventative health behaviours to help us be resilient in the face of climate change. And my definition of a health supportive place is certainly a place that facilitates healthy behaviours while acknowledging that we do live in a world impacted by climate change. So thank you, Marley. I'll stop there and look forward to the discussion.
Thanks so much, Susan. That was awesome and fascinating. So now on to our final presenter, Dr. Lyrian from the University of Adelaide, to tell us about housing, climate change and mental health outcomes. So Lyrian is a senior lecturer at the Department of Geography, Environment and Population and Deputy Director of the Australian Centre for Housing Research at the University of Adelaide. Her research focuses on the relative risk of housing disadvantage, household lived experience of poor housing conditions, and the implications for population health and well-being. So over to you, Lyrian.
Thank you so much, Marley. I would also like to acknowledge that I'm speaking from country today, and Ghana country, where I live and work. So this is Adelaide Plains. I acknowledge that this land was never ceded and that the Ghana people have a deep and ongoing relationship with country. I pay my respects to elders, past, present, and future. So when Marley asked me to speak to the topic of climate change, built environment, and mental health, lots of ideas went whizzing through my head. But above all, the thing that really stood out is that we already know who's going to be most affected by climate change. And I guess while this sounds bleak, it does give us an opportunity then to gear public policy towards providing protection or greater assistance to people within this vulnerable cohort. So perhaps I'll spend a couple of slides explaining, and you can see if this idea holds up. So across much of the work that we do here at the Australian Centre for Housing Research within the University of Adelaide, we see time and time again when we look at different housing problems, whether, for example, cold housing, precarious housing, unaffordable housing, all of these problems sort of follow patterns or existing patterns of disadvantage. So reflecting on the frame of this webinar then, I suggest that we might see the problems of environmental risk, mental health burden, and inadequacies within our built environment in a similar manner. So almost as a collision of several different existing patterns of disadvantage. So for anyone who is quite interested in this, I would just say Anthony McMichael wrote beautifully on patterns of disadvantage and the distribution of environmental risk in 1999, if you are interested in reading more. It's just a particular piece that I enjoy. So to try and illustrate this with a more perhaps tangible example, I've done an extract from the Australian Rental Housing Conditions data set, which I'll sort of explore for the next few slides and then return back to this central idea and consider how I guess this idea may enable us to better target or structure policy response. So the Australian Rental Housing Conditions data set was collected in 2020. It's part of an ongoing program of research to really develop research infrastructure and develop, I guess, a data infrastructure to be.
Sorry to interrupt. Just letting you know, unfortunately, your slides aren't changing. Do you mind trying to share again? And we're still on disadvantage colliding.
Oh dear, thank you. Yeah. Let me see. What can you see now?
The Australian Rental Housing Conditions.
Okay, beautiful.
Okay.
Well, let me just, so there was the main one, and then I presented, I guess, this trifecta of problems, and then we're on to the housing conditions. So sorry, I'll just click through, not in full screen mode. So the data set, this work was started in 2016 and really aimed to provide a research resource to explore the impact of housing conditions on people's health and well-being. So the data set, this one in particular, contains detailed information on the housing conditions and well-being and demographics of 15,000 renters Australian-wide. And I mean, I could talk about this for ages, but just a quick note perhaps that the data is available and free to use for non-commercial research via the Australian Data Archive. And I've popped a couple of references on the slide in case you are interested in exploring that more. So turning to what renting looks like in Australia, and these are all figures from this recent survey. So renting is really no longer a transitional tenure. Once renting was perhaps seen as a bit of a rite of passage, maybe leaving the parental home, perhaps going into a shared rental home while you study or early in the career, and then to save up and go into home ownership. So within this context, I guess poor housing conditions were not really seen as a major issue, but now rental households span all age groups. Some people will be renting for life. And it's exceptionally important for those people that I guess the rental sector is able to provide a healthy and safe, supportive living environment. So from this data set, just 10% of renters found their rent unaffordable. But the thing that really hit me is when we asked respondents about financial hardship, 50% did not have enough money after paying rent and covering essentials to save. So you can really see how there's sort of these long-term patterns of perhaps disadvantage for people within this sector. 68% of renters were experiencing major building problems. So things like mold, damp, plumbing issues, structural issues, cracking. That's a huge number, I think. And I think it probably just points to the overall condition of dwellings within this sector. And almost 1 in 3 renters had experienced delays on maintenance and other requests from their landlord or property manager. And then the final point I'll just quickly touch on is that the majority of houses, captured within this data set were built before energy efficiency requirements were introduced to the building code. So we can perhaps touch on that a little bit more later. So to start us off with looking at, I guess, how renters' mental health is failing, or to give an overall picture, taking the whole sample, we asked respondents to self-assess their mental health, really on a scale from excellent to poor. I'm not very sure how these figures compare, I guess, to a general population or validated measures, but what it does give us is a bit of a starting point for the next few slides, where we'll look at different housing outcomes and mental health. So some of the data suggests or might be interpreted as the most vulnerable are least protected. So within the whole sample, 23% of renters reported being unable to keep warm in their home during winter time. And then if we look at this proportion, unable to keep warm within the different mental health categories, we see that far higher proportion of people with poor or fair mental health are reporting inability to keep warm. And the pattern is similar for heat in summer. So I guess this is a small way, but it really starts to assist us in gaining some insight into the ways in which our housing can mitigate or in some cases worsen environmental risks. So for example, heat and then cold, but I guess while we didn't collect data on it per se, you could also imagine other instances of things like flooding and perhaps bushfire or smoke as well. So we asked renters in this survey whether they felt that their housing had had a negative impact on their mental health in the past 12 months or not. Overall, 36% of renters said, yeah, I think it has. And then again, looking within the different mental health categories, we see sort of a similar gradient where people with poor mental health are much more likely to report this perception of that their housing might be responsible for negative impact on mental health in the previous 12 months. I guess at this point, it is important to acknowledge that these data are cross-sectional, so we can't really draw any sort of causal inference from this. But in other modelling that we've done that is causal, we've looked at the cumulative impact on unaffordable housing costs on mental health. And the key thing relevant to today's talk really from this work is that where you start matters. So when exposed to high housing costs, people with poor initial mental health fared the worst over time, while people with very good mental health barely registered any effect. So within this context of today's webinar, and I guess this would be something to test in future research, this may suggest that the people with already poor mental health would be disproportionately affected by the impacts of environmental risks. And a final sort of slide from this data set is that really, in many cases, we're dealing with quite a constrained population. So this is just one of the things I was able to pull out of the data to perhaps illustrate this. But of the 10% of renters who reported poor mental health, 70% thought that they would move within the next 5 years. Perhaps that's not so surprising, but then we also asked why they might be anticipating a move. And many cited issues of constraint. So somewhere more suited to physical needs, which perhaps implies that their current housing doesn't suit their physical needs, having issues with property manager or landlord, and then worried about unaffordable housing costs. So I think taken collectively, these few graphs sort of demonstrate clearly or point to that there's a cohort of people within our community that are really facing this trifecta of poor housing conditions, poor mental health, existing mental health, and little or no agency really to improve the protective capacity of their housing against environmental risks. And so to end on a sort of more happier note or a more positive note, I think the good news here is that we, and I guess taking a very, very big collective we, really have this opportunity to put in place protections, or at the very least provide rapid and targeted assistance to these groups within our society that we know are likely to be more vulnerable. I think this is really contingent though on sort of joined up and person focused government, so or government provided services. So one where anybody with a connection to government provided or funded services, whether mental health care, social housing, tenancy tribunal, cost of living concessions, disability or age pension, income support payments, for example, is offered or at least alerted to other forms of protection, care and assistance. And then just to end, bringing this back to the frame of the webinar, I guess, we have this incredible opportunity to lessen the individual impacts of climate change, but it really does need sort of this central government leadership. So thank you.
Okay, thank you so much, Lyrian, for that. That was awesome. So I'm going to hand over to Liv Green now to host the Q&A.
Hi, everyone. So thank you all speakers for such wonderful presentations. So we just have a few quick minutes for a few questions. So please ask any questions you have in the Q&A. We'll start with this question from Megan Phelps, and maybe it's not directed at any presenters, so maybe whoever would like to answer it can just jump in. Which current Australian policy documents would you most like to change to improve the situation for all?
Yeah, great question. Well, I'd go straight for the 100% renewables by 2030. Actually, I'll start there.
Well, I'll jump in terms of healthy built environments. We have the most amazing amount of policies, actions, toolkits. We just have the, well, more than hesitancy, we just have a government, our leaders just aren't sort of taking up these actions that are out there in the strategy documents. So it's a lot of it's up to us to be advocating, to be urgently saying to our leaders, like you were suggesting before, Susie, that this has got to happen. We know how to do it. It's just facilitating the actions.
Okay, thank you, speakers, for answering that question. So the next question we have is from an anonymous attendee, but what would be the research priorities and challenges in this space?
Well, just on the end of what I just said, it's more that the challenge of activation. Sure, there's always more research we can do, but in healthy built environments, in terms of making an environment health supportive, we know how to do this, but the actual action, bringing together different stakeholders, is often a real sticking point. So it's about the activation, I think.
Are there any other speakers who'd like to talk to that question?
Perhaps just in support of Susan's answer, that really we have such good research, so many fantastic models of what good models of service provision and built environments and things like that. It really is this impact. How do we actually realise the translation of some of these ideas that might be confined to sort of academic discussions to policy and things like that?
Great, thank you. So we are almost at time, so we might just ask one or two very quick questions. So one question from someone in the chat is, what incentives exist for landlords and developers to consider these problems, and what mechanisms are there to make them take them seriously? So maybe Lyrian, you might want to start with.
Yeah, there's currently not a lot for landlords in terms of incentives. I think a sort of thing that's emerging across the states, but really led by Victoria, is mandating much higher minimum standards for rental properties. So I guess that's more of a stick rather than a carrot. There's also there's been a lot of discussion around changing tax arrangements, so sort of energy efficiency type improvements to dwellings can be tax benefit to landlords, whereas it's not currently. But it probably is looking more like the regulation and stick at this point.
Anyone else wanting to respond to that one?
Oh, just in terms of healthy built environments, in some respects, no, not many incentives for developers to take up these things, although the very savvy developers realise that this can give them an incredible edge in the products that they're actually putting on their markets, and reap enormous benefits for them as developers. But then, of course, that has unintended consequences in terms of affordability. So getting back to some of the issues you're talking about, Lyrian. So it's tricky. We don't have a mechanism to sort of calculate the enormous reductions in longer term health costs that implementing health prevention measures will bring about. And of course, increasingly, this is going to also, I think, have to factor in the cost to us of dealing with climate change and its impacts across all of the the direct, the indirect, the vicarious, all the categories that Susie brilliantly articulated earlier on. So yes, we really need some shifts in the way that we deal with these things and incentivise what is a market-led system. Neoliberalism has not served us well. I'll stop there.
Thank you, speakers, for your insightful responses. We'll just answer one more question and then I think we'll wrap it up because we are over time. So from Tim Walsh, how can we ensure we have healthy built environments as densities increase in our cities? While density is good, it seems that any healthy interventions come after the apartments.
Yeah, well, very, very important question. Probably we just don't have a lot of time to really obviously get into the details of that, but yeah, density poses certainly some big issues. One of the most important things around density is the provision of adequate green open space, and it's not just enough to say, oh, it's well designed, but we actually have to have sufficient amount of green open space for additional people coming into apartments, living closer together without access to private open space. But yeah, that's just one tiny piece of that puzzle in terms of addressing how we do that. But there's a lot of, as I said, a lot of kits, a lot of information, guidelines that are out there, both from the health sector and the built environment sector, so that you can drill down into some of those which have a lot of information about how high density and medium density can be health supportive.
Okay, great. Thank you everyone for those responses. I might just hand over to Molly to wrap.
Yeah, thank you so much, everyone. That was incredible. I really enjoyed that hour. So everyone will receive an email tomorrow with some follow-up information, and if they want to join the network and any advice for future webinars people might want to see. But we will also send out a recording later on for those who missed it. And I know I got around 50 emails of people who were in that boat, so really exciting. But thanks everyone.